This is me Arzu here and I welcome you to my channel Mr. Teeth, where your dental concept get dissected. So this is our part 2 video of the alveolar bone, and in this video we will be discussing with the bone histology and the bone cells. Okay, so in this video we will be discussing with the general histology of the bone. Okay, I think you have studied about this in your general anatomy and general histology too. Okay, but also we will be discussing this here little bit, and after that we will discuss in detail about the bone cells. Okay, and which is important, sometimes they can ask you in the short notes. Okay, so now without delaying much, let's start our today's video. So our today's topic is about the bone histology. Okay, first of all, so in the bone histology, in the first point, okay, so it is the osteoid. Okay, so osteoid is an unmineralized bone matrix. Okay, so everyone will know this. Okay, so osteoid is a unmineralized. Okay, this is not mineralized. Okay, so there is no any kind of the mineral present in the osteoid. After that, it is approximately 5 to 10 micrometer before the commencement of the mineralization. Okay, so this is a can be framed into the MCQ question. So it is approximately 5 to 10 micrometer thick. Okay, before the commencement of the mineralization. Okay, after that, in another point, it contains the type 1 collagen fibers parallel to the bone surface embedded in the ground substance of the proteoglycan, glycoprotein and the other proteins. Okay, so you should remember here that, okay, so this osteoid is a unmineralized bone matrix and it is approximately 5 to 10 micrometer in the thickness before the commencement of the mineralization. Okay, so this osteoid contains the type 1 collagen fiber. Okay, and that collagen fibers are embedded in the ground substance of proteoglycans, glycoprotein and other proteins. Okay, and after the formation of the osteoid, okay, so there is a formation of the bone. So this osteoid give a proper framework. Okay, it gives a bone matrix. Okay, organic bone matrix is given by the osteoid upon which the mineralization takes place. Okay, after that, in another point, okay, so outer aspect of the compact bone, okay, have the fibrocollagenous layer. Okay, so now we will start with the discussion with the compact bone histology. Okay, so outer aspect of the compact bone have fibrocollagenous. Okay, and this word is very important. Okay, so there is a fibro and collagenous layer present in the outer aspect of the compact bone, and that is called periosteum. Okay, and in periosteum we have a outer layer and also inner layer. Okay, and in outer layer we have fibrous layer. Okay, and outer layer is a fibrous layer, and inner layer, okay, inner is a osteogenic layer. Okay, so outer is a fibrous layer, inner is a osteogenic layer, and in the outer layer we have dense irregular connective tissue. Okay, so in the periosteum we have outer and inner layer, and in the outer layer we have dense irregular connective tissue. Okay, and there we can see the different kind of fibers. Okay, so it is termed as a fibrous layer. Okay, so dense irregular connective tissue is present in the outer layer, while in the inner layer it is a osteogenic layer and it is next to the bone surface, contain the blood bone cells. Okay, so we can see the bone cells. Okay, osteoblast, osteocyte is present there. Also, the rich vascular supply is present in the inner osteogenic layer. Okay, so we have a two layer in a periosteum. One is an outer layer and another is an inner layer. In the outer layer we have fibrous layer and dense irregular connective tissue is present there, while in the inner osteogenic layer we have rich vascular supply and the bone cells are present in the inner osteogenic layer. Okay, so now in this inner surface, okay, so we have discussed about the outer aspect of the compact bone, okay, which is a fibrocollagenous. Okay, outer layer and inner layer is there. Okay, so now in the inner aspect, okay, means if this is a cross section. Okay, so if this is a cross section, then we can see the outer layer here, and this is a fibrocollagenous. Okay, so this is outer layer and this is a inner layer. Okay, and there is a canal. Okay, so that is a medullary canal. Okay, that we have discussed in a previous video. Okay, so we have cut the bone in a transverse section. Okay, and we are looking the a section, a transverse section of the bone, and this is a medullary canal here, and this is a transverse section of the bone here. Okay, so the outer layer is a fibrocollagenous and inner layer is a thin cellular layer that is called endosteum. Okay, and there is a quiescent osteoblast and osteoprogenitor cells are present on the endosteal surface. Okay, so quiescent means it is not participating in the cell division. Okay, so it is just in the phase of rest. Okay, so there is a quiescent osteoblast present there, and osteoprogenitor cells are present on the endosteal surface. Okay, so in the inner surface we can see such type of cellular layer there. After that, in at the periosteal and the endosteal surface, the lamellae are arranged in a parallel layer called the circumferential lamellae. Okay, so at the inner layer, okay, so we can see the lamellae. I will be showing you the picture. Okay, so they are parallel, okay, with each other. So they are parallel with each other, and they are called the circumferential lamellae. Okay, so they are circumscribing the bone. Okay, so they are the circumferential lamellae at both the end, periosteal end and the endosteal end. Okay, so the lamellae are present there. They are called the circumferential lamellae. Okay, so particularly we have three different kind of lamellae in the bone. We have circumferential lamellae, another is the concentric lamellae, and another is the interstitial lamellae. Okay, so this can be asked you in the viva. So circumferential lamellae, concentric lamellae, and the interstitial lamellae. Okay, after that, in this point, deep to it, okay, lamellae are arranged in concentrically around the central vascular canal, while the Haversian canal, which is 50 micrometer in diameter, along with the concentric lamellae. Okay, Haversian system or the ostium is formed. Okay, so in this point same thing is written. Okay, so as I have told you that there are three different kinds of lamellae. One is circumferential lamellae, which is just inner to the outer layer and inner to the inner layer. Okay, so they are arranged parallelly. Okay, and they are at the outer and inner aspect, so they are called the circumferential lamellae. Okay, but these concentric lamellae are present in between those circumferential lamellae, and they are arranged around the Haversian canal. Okay, so if this is a Haversian canal, then we can see the lamellae. Okay, so we can see the lamellae are arranged around the, okay, around this Haversian canal. So that is called the concentric lamellae, and along this concentric lamellae and this Haversian canal, this proper structure is called the osteon. Okay, so osteon or the Haversian system. Okay, so osteon or the Haversian system means the same. Okay, after that, 20 concentric lamellae can be present within each stone, each osteon. Okay, this can be actually an MCQ. After that, we have two different kinds of lines. Okay, and they are very important. One is the reversal line, another is a resting line. So in the reversal line, site of the change from the bone resorption to the bone formation or the deposition is represented by the scalloped outline. Okay, so with this definition, you can clear your concept of this reversal line. Okay, so just you should know about this reversal line is that, okay, so there is a scalloped outline. Okay, so this is a scalloped outline. One side, okay, there is a bone that is newly forming, and another side there is a bone which is bone resorpting. Okay, so from the bone resorpting side, so BR means bone resorpting and BD means bone deposition. Okay, so this is the scalloped outline which is separating the bone resorption, okay, portion of the bone with that of the portion of the bone where there is a bone formation or the deposition. Okay, so there is a scalloped outline that is rich in a shallow protein and the osteopontin. After that, appears to be highly irregular as it's formed by the scalloped outline of the Haussip's lacunae. Okay, so about this Haussip's lacunae and osteoclast, okay, we will be discussing further, but for now they are scalloped, okay, or irregular because of the scalloped outline of the Haussip's lacunae. Okay, so you should remember this. So in reversal line, just you should think it is a scalloped outline that is separating the bone formation with the bone deposition, bone deposition, and then it contains the shallow protein and osteopontin in more amount, and the scalloped outline is due to the scalloped outline of the Haussip's lacunae. Okay, so now in the resting line, we have regular appearance denotes the period of the rest during the bone formation. Okay, so in the resting line we have regular appearance. Okay, so it is not irregular or scalloped as that of the reversal line, but they are regular. It denotes the period of the rest during the bone formation. Okay, so this is simple to understand. So we should know about this reversal line and the resting line. After that, in another point, adjacent Haversian canal are interconnected by the Volkmann canal that contain the blood vessel rich network. Okay, so this Haversian canal, okay, so when you just cut the bone in a transverse section, okay, so if this is a transverse section of the bone, then you can see the Haversian canals are present there. Okay, so Haversian canal are running longitudinally and you are cutting the bone transversely, so you can see the Haversian canal easily. Okay, Haversian system you can see easily. But when you cut the bone longitudinally, okay, then you can see that Haversian canal. Okay, so if this is a Haversian canal, if this is another Haversian canal, then they are connected horizontally. Okay, they are connected horizontally by a Volksmann canal. Okay, so that is written here. Okay, so adjacent Haversian canals are interconnected by the Volksmann canal. Okay, that contain the blood vessel, that is rich blood vessel rich network. Okay, so this Haversian canal and the Volksmann canal, okay, so they form the proper blood vessel rich network. After that, in another point, okay, so osteocytes are present in the lacunae. Small canaliculi radiate from the lacunae to the Haversian canal, and this forms the connecting system which permits the nutrient and the waste to be relayed. Okay, so this there is a lacunae present there. Okay, so I will show you the picture. So in the lacunae, we can see the osteocyte is present there. Okay, so about the osteocyte and osteoblast we will be discussing further, but for now, so osteocytes are present in the lacunae and small canaliculi, okay, is radiated. Okay, so if this is a if this is a lacunae, okay, so we can see the different canaliculi running from it. Okay, different canaliculi are running from it. Okay, and we can see a osteocyte inside it. Okay, so there is a osteocyte inside it. Okay, so osteocyte are present in lacunae, and lacunae is a space between the lamellae. Okay, and they are small and they have small canaliculi radiating from it. Okay, and the lacunae to the Haversian canal. Okay, so those canaliculi are radiating towards the Haversian canal, and those form the connecting system which permits the nutrients and the wastage to be relayed. Okay, and between the concentric lamellae there is a interstitial lamellae. Okay, so in this picture, as this is a schematic diagram, so we can see the concentric lamellae just at the periosteal and the interstitial end. Okay, and we can see the osteon present there, and if there is another osteon. Okay, so just think this is another osteon. Okay, so if this is another osteon, if this is another osteon, then at this portion, okay, so in at this portion, okay, so which I am showing by the purple color. Okay, so this is a interstitial lamellae, okay, between the two Haversian system. Okay, I will be showing the picture, okay, real image of this histology, then you will be more clear. Okay, so just think we have three different kinds of lamellae present here. Okay, so now we will discuss with the spongy bone. Okay, so in the spongy bone, okay, so the histology we have discussed now is the about the compact bone. Now we will discuss with the spongy bone. Okay, they have the large cylinder spicules called trabeculae are present there with the 50 micrometer thick, and they are arranged along the lines of the stress to withstand the forces applied to the bone. Long marrow species are present there. Okay, so spongy bone is present at mostly at the epiphysis. Okay, and compact bone is present at the diaphysis of the long bone. Okay, so in this spongy bone we have the long spicules. Okay, long cylinder spicules called trabeculae. Okay, and which is 50 micrometer thick. Okay, after that they are mostly generated. Okay, they are mostly arranged along the lines of the stress. Okay, so they are arranged along the lines of the stress to withstand the forces. Okay, and we have different marrow species which are larger in shape. Okay, larger in size in this spongy bone. After that, about this hemopoietic tissue in the bone. Okay, so we have a red marrow and the yellow marrow. Okay, so in the red marrow it is present in the young bone found within the cavities of the spongy bone of the long bone and the diploe of the flat bones. Okay, so about this diploe, okay, so between the two tables we have diploe. Okay, in the skull bone, when we see the transverse section of the skull bone, okay, then we can see the two tables are there. Okay, so two tables are compact. Okay, so between the two compact bone inside there is a this marrow. Okay, marrow like a structure, red marrow is there. Okay, so that is called diploe of the flat bones. Okay, after that contain the stem cells of the both fibroblast or the mesenchymal type and blood cells lineage. Okay, so this red marrow they are present in the young bones. Okay, and they are found mostly in the cavities of the spongy bone of the long bones or in the diploe of the flat bones, and the contents of this red bone is the stem cells of both the fibroblast and mesenchymal fibroblast or the mesenchymal type and the blood cell lineage. Okay, so blood cell lineage stem cell is also there, and a fibroblast lineage. Okay, fibroblast stem cell is also present in this hematopoietic tissue of the in this red marrow, okay, of the bone. Now in this yellow marrow, okay, so it is seen in the epiphysis of the long bone, and it is present in the old bone, okay. So with the age there is an increase in the number of the yellow marrow, okay, and it is due to the accumulation of the fat cells, okay. So now in another point, so this yellow marrow can be changed into the red marrow, okay. So if the person is anemic and needs increased red blood cell production, then yellow marrow can be changed into the red marrow. It is a sort of adaptation of our body, okay. So this is a general thing, okay. I think you have studied in your general subject, okay, general subject of basic science. So now we have completed with the histology of the bone. So now we will see the pictures. Okay, so in this picture, as we can see, okay, so this is a schematic diagram of the compact bone and the spongy bone, okay. So towards the medullary canal side we can see the trabeculae, and that is a spongy, okay, spongy bone. And outside of that trabeculae bone we can see the endosteum, okay. It is not labeled here, but there is a endosteum in the inner side of the compact bone. After that we can see the lamellae present there, canaliculi, okay. And also we can see the periosteum, okay, blood vessels are visible there. Similarly lacunae containing osteocyte, okay. So as I have discussed earlier, there is a osteocyte in the lacunae, and from the lacunae we see the canaliculi running from it, okay. And after that we can see the lamellae, okay. So those lacunae forms the layers, okay, layers that is encircling the Haversian canal, and also at the circumscribing end of the compact bone, so that forms the lamellae. And the Haversian system is called the osteon, okay. And also here in Haversian canal and in the Volkmann canal, okay, so Haversian canals are running longitudinally and they are joined by the Volkmann canal, okay, and they are the network of blood vessels, okay. And about the lamellae, okay, so in this picture it is not much visible about the lamellae, okay, but as I have discussed previously, okay, so this is a part of the general histology. So I hope I consider that you have a concept in this lamellae, and in the next picture you will be looking about the concentric lamellae there. And now in this picture, as we can see, okay, so this is a cross section of a one osteon or a Haversian system. So we can see the cement line, okay, that is some circumscribing it, okay. It is just separating this Haversian system from other systems of the bone, okay. So it is just a outermost layer of the Haversian system. After that we can see the lamellae, okay, bone layers, okay, that is written in the bracket. Similarly we can see the lacunae present there, and through the lacunae we can see the processes, okay. Processes are arising from those lacunae. And after that in the middle, okay, we can see the Haversian canal or the central canal, okay, and lacunae space containing the osteocyte, okay. So I think you got it. Okay, so now we will discuss with these bone cells, okay. So in the bone cells we have three different kinds of the cell: osteoblast, osteocyte, and the osteoclast, okay. So first we will discuss with this osteoblast. So now in this osteoblast we have a mononucleated cells, okay. The functions of the osteoblast is the synthesis and the secretion of the osteoid, and the osteoid is a unmineralized bone matrix, okay. So osteoid is a unmineralized bone matrix upon which there is a mineralization, okay. So after that basophilic, plump, cuboidal or slightly flattened cell, okay. So they are cuboidal or slightly flattened cell found on forming surface of the growing or the remodeling bone, okay. So they are mononucleated, they are basophilic, and they are cuboidal or flattened, forming the surfaces, okay, of the growing or the remodeling bone. After that they have abundant rough endoplasmic reticulum, okay. After that procollagen and other organic constituent of the bone matrix synthesized by the organelle, okay, carried by the transverse vesicle to the Golgi complex, and they are assembled within a Golgi complex in the secretory granules, okay. Okay, so this they are abundant, okay. Rough endoplasmic reticulum, R is abundant in the osteoblast, okay, as they are synthesizing cell. And this about the osteoblast we have also talked in another chapter, okay. So in the previous chapters of the inferior dorsal ligament, okay, so we have prepared the table there. So same thing is written here also. So we have abundant rough endoplasmic reticulum in this osteoblast, and this procollagen and other organic constituent, okay. So procollagen means the phase of the collagen, okay, the protein that is just prior to the formation of the collagen, okay, which is going to be formed as a collagen, but it is prior to the formation of the proper collagen. So there is a pro-collagen and other organic constituent, okay, of the bone matrix, and they are synthesized by the organelles, okay. So and the organelles are the rough endoplasmic reticulum, so they are secreted by the rough endoplasmic reticulum, and they are carried to the Golgi complex by the transverse vesicle, and they are arranged in the Golgi complex by within a secretory granules, okay. So this is not quite important, but you can just remember it have RER and procollagen and organic constituent are just formed by the organelles, and they are transferred to the Golgi complex, okay, in a simple way. After that, non-collagenous protein are also released along the osteoblast surfaces, okay. So non-collagenous proteins are also released along the osteoblast surface. After that, the nucleus is situated eccentrically in the part of the cell, okay. So eccentrically means not in center, okay. So at the not in the center means at the corners, okay. So it is present eccentrically, nucleus is present eccentrically, and this is a morphology of the cell. After that, organic matrix is deposited around the cell body, and their cytoplasmic processes resulting in the formation of the canaliculi, okay. So organic matrix, so osteoblast organic matrix is deposited around the cell bodies, okay. So around the cell bodies we can see the deposition of the organic matrix, okay, that is osteoid, and their cytoplasmic processes, okay, resulting in the formation of the canaliculi, okay. So this we can learn this, but this is not too important, but also we can just see once, okay, about this. After that, cells are adherent by the adherence and the gap junction, okay. After that, osteoblast also contain the prominent bundles of the actin, myosin and the cytoskeletal proteins that are associated with the maintenance of the cell shape, attachment and the motility, okay. Okay, so till now I have discussed with the morphology of the osteoblast, okay. So in the morphology of the osteoblast, you just take a proper and shortcut concept, okay. So that is the, it is mononucleated basophilic cuboidal plump cuboidal with a slightly flattened cell, okay, and it is present on the growing or the remodeling surfaces of the bone. Abundant RER is there, okay, abundant Golgi complex is there, and procollagen and the organic constituent are synthesized by the organelles, and they are transferred to the Golgi complex, okay, by the transverse vesicle, and at the Golgi complex they are assembled in the secretory granules. After that, different kind of non-collagenous proteins are also released from this osteoblastic surfaces, okay. Osteoblasts and organic matrix deposited around the cell bodies with the cytoplasmic processes resulting in the formations of the canaliculi, okay, and they are just linked by the gap junction and adherence, and it also contain different kind of cytoskeleton like actin, myosin and cytoskeletal proteins, okay. So that is just a morphology of the osteoblast in detail, okay. So this is a detailed morphology of the osteoblast. After that, in the formation section, so we can see the I prepare the table, okay. So this flow chart is important, okay, sorry, not table, it is a flow chart, okay. So this flow chart is very important. So undifferentiated pluripotent mesenchymal stem cells, okay. So this is very important line, okay. So they can ask in the MCQ question, okay, also in a viva. So what is the origin of the osteoblast, okay, also we have discussed about this in the previous chapters, okay. So in periodontal ligament, so it is formed from the undifferentiated pluripotent mesenchymal stem cells, and that gives the osteoblast, okay, and that is giving the osteoblast, okay. So now this osteoprogenitor cells, okay. So osteoprogenitor cells, we have two different kinds of the osteoprogenitor cell. One is a determined osteogenic precursor cell, DOPC, and another is a inducible osteogenic precursor cell, IOPC, okay. So DOPC is there and IOPC is there, okay, and this DOPC is present in the bone marrow, endosteum and the periosteum, while this IOPC is present in other organs except those three, okay, and they both differentiate into the bone cells until the stimulation, okay. So this osteoblast is formed from the undifferentiated pluripotent mesenchymal stem cell, okay, and those stem cells are the osteoprogenitor cells, okay. And osteoprogenitor cells, we have two different kind of the osteoprogenitor cell, DOPCs and IOPCs. And DOPCs, it is present in the bone marrow, endosteum and the periosteum, while IOPCs are present in the other organs, okay, and both these, okay, are differentiating, okay, into the bone cells, Okay, so both these differentiate into the bone cells and under the stimulation, certain stimulation. Okay, and that forms the osteoblast. Okay, so this can be asked. Okay, so where is the DOPC, where is IOPC? Okay, after that, in the function section, so formation of the new bone, okay, bone remodeling and mineralization. Okay, and in the another point, osteoblast express receptors of the various hormones, including the parathyroid hormone, vitamin D3, estrogen, and glucocorticoids that is involved in its regulation of the osteoblast differentiation. Okay, so this is also very important. Okay, so in the regulation section of the osteoblast, we have parathyroid hormone, vitamin D3, estrogen, and the glucocorticoids involved. Okay, okay, so now we'll discuss with the osteocyte. Okay, so how the osteocytes are formed. Okay, what the morphology of the osteocyte we will be seeing here. So osteocyte, as the osteoblast from the bone matrix, they get entrapped within the matrix and they form the osteocyte. Okay, so this is a formation of the osteocyte. Okay, so by the trapping, okay, by the trap of the osteoblast in the matrix of the bone, okay, it forms the osteocyte. After that, number of the osteoblasts that become osteocyte depend on the rapidity of the bone formation. Okay, so number of the osteoblast, okay, number of the osteoblast that is forming the osteocyte, it depends upon the rapidity of the bone formation. Okay, so if the bone formation speed is more, okay, so there will be more formation of the osteocyte. Okay, there will be more entrapping of the osteoblast, so there will be more formation of the osteocyte there. Okay, so this is a general common sense. After that, embryonic or the ovine bone shows more osteocyte. Okay, because there is a more rapidity of the bone formation. After that, within a bone matrix we have osteocyte reduces in size, creating, okay, reduces in size, creating a space around it called the osteocytic lacunae. Okay, so this osteocytic lacunae or the lacunae means same. Okay, so in the lacunae we can see the osteocyte. Okay, so same thing is written here in another perspective. Okay, so within a bone matrix we can see the osteocyte, okay, which is reduces in its size. Okay, osteocyte reduces size and the space is created there. Okay, and that space is called osteocytic lacunae, and lacunae appears as ovoid or the flattened structure. Okay, so there is space actually. Okay, and lacunae appears the ovoid or the flattened structure, and those combinations of the lacunae, okay, gives the lamelles. Okay, so those formations of the lacunae, okay, form the lamellae. After that, those lacunae appears ovoid or the flattened with the canaliculi in which there is an extension of the osteocytic processes. Okay, so previously also we have discussed with the canaliculi is present there in the lacunae, and in this canaliculi we can see the processes, okay, of the osteocyte there. After that, eccentrically placed nucleus which is similar with that of the osteoblast. Okay, and with the thin rim of the basophilic cytoplasm. Okay, so it is also similar with this of the that of the osteoblast. Okay, so there was also the cytoplasm which is basophilic, but there was not the thin rim. Okay, but there is a thin ring like structure, okay, present on this basophilic cytoplasm. After that, RER, Golgi apparatus, and the secretory vesicles are also present in this osteocyte. Okay, so RER, Golgi apparatus, and the secretory vesicles are present in this osteocyte. Okay, so this is a just a overview of this osteocyte. Okay, so you can just remember, okay, that it is formed from the entrapped of this osteoblast. Okay, it is present in the osteocytic lacunae. Okay, it decreases its size and there is a formation of the osteocytic lacunae, and the cytoplasmic processes runs in the canaliculi of those lacunae. Okay, after that it is formed. Okay, if the bone formation is rapid, then there is more formation of the osteocyte. Okay, due to the more entraption, okay, more entrapping of the osteoblast. Okay, so now we will discuss with this osteoclast, which is more important. After that, okay, so removes the bone tissue by removing the mineralized matrix of the bone. Okay, so the main function of the osteoclast is to remove the bone tissue. Okay, by the removing the mineralized matrix of the bone. Okay, so clast means it just cut off. Okay, so it just destroy the bone. Okay, it just resolved the bone. So that is the main function of this osteoclast. Okay, so it lie in the resorption bay called the Hausip's lacunae. Okay, so there is a proper lacunae for this osteoclast. Okay, so that is called the Hausips lacunae, and in this Hausips lacunae we can see the osteoclast is there present. Okay, after that in another point, okay, so osteoclast, they are large cell, okay, with 40 to 100 micrometer in diameter with 50 to 20 closely packed nuclei there. Okay, so this is a morphology of the osteoclast. Okay, so the distinguishing feature of the osteoclast is that, okay, so they have closely packed different 15 to 20 nuclei are there. Okay, and osteoclast with the more nuclei resolve more bone than the osteoclast with the few nuclei. Okay, so with osteoclast that have the more nuclei, okay, then it is more powerful, it will resolve more, and osteoclast with a few nuclei it will resolve less. Okay, after that, cytoplasm of the osteoclast show acid phosphatase containing vesicles and the vacuoles, and this presence of the acid phosphatase distinguishes the osteoclast from the other giant cell. Okay, so the structure of the osteoclast, okay, is quite similar with that of the giant cells. Okay, in giant cells also we can see the different nuclei. Okay, large number of nuclei is present inside the cell, but the distinguishing feature between this osteoclast and the giant cell is that the acid phosphatase chemical. Okay, so acid phosphatase chemical is just present in the osteoclast, but it is absent in the giant cell. Okay, after that, mitochondria are extensive and distributed throughout the cytoplasm except below the ruffled border. Okay, so I'll show you the picture of this osteoclast. Okay, then you will be more clear about this Hausips lacunae and about this space. Okay, ruffled border. Okay, so you will be more clear now. So I have discussed about the reversal line. Okay, so scalloped outline is there, so that scalloped outline is present due to the scalloped outline of this Hausips lacunae. Okay, and this is the ruffled border. Okay, so I'll be discussing this more critically in the picture. So just for now you should think mitochondria are extensive throughout the cytoplasm, but it is ex- except the below of the ruffled border. Okay, so just adjacent to the ruffled border there is a less presence of the mitochondria there. And Golgi complex is extensive and is present in stacks. Okay, Golgi complex is extensive, present in stacks. Cathepsin containing vesicles are present closely to the ruffled border. Okay, so this ruffled border adjacent we can't see the mitochondria or the Golgi complex, but the thing that we can see is the vesicles containing the cathepsin, so which are responsible for the resorption. Okay, so and it is derived from the hematopoietic cells of monocytic macrophage lineage. Okay, so that is the origin of the osteoclast. Okay, so now I will draw the schematic diagram, okay, to make you understand the things. So this is a osteoclast. Okay, so in osteoclast we can see the one smooth border is there, another is a ruffled border. Okay, so this is a ruffled border and this is just adjacent to the Hausips lacunae. Okay, so this is space is called Hausips lacunae, and this is the surface of the bone, okay, which is going to be resorbed. Okay, so it is going to be resorbed, it is going to be destroyed. Okay, so at that position, okay, we can see the osteoclast, and in the osteoclast 2, okay, so the ruffled border is just adjacent. Okay, it is facing towards the surface that is going to be resolved. So we can see the ruffle border here, and in the ruffle border there we can see the cathepsins. Okay, so cathepsins that is filled with the, okay, vesicles that is filled with the cathepsin is present in this osteoclastic ruffle border side. Okay, but mitochondria are not present here, Golgi complex is not present here, mitochondria are present in other parts of the cells of the osteoclast. Okay, so this is a proper structure of this osteoclast, but I will show you the picture also now. In this picture, as we can see, okay, so different types of bone cells is shown here. So first is our osteogenic cell. Okay, so that is the progenitor cells of every cells of the bone. Okay, especially the osteoblast. Okay, so first form cells in a bone cell is the osteoblast. So osteogenic cell, we can see it is quite of in spindle shape. Okay, and nucleus is at center. Similarly, after that we can see the osteoblast. Okay, and it is quite of cuboidal or the flattened. Okay, so it is cuboidal or flattened, nucleus at the center. Okay, basophilic cytoplasm we have. After that we can see the osteocyte is there. Okay, and from osteocyte we can see different kind of processes are arising. Okay, and those processes are lodged in the processes that are arised from the lacunae. Okay, so we have discussed about this properly previously. After that we can see the osteoclast. Okay, and in the osteoclast we can see at the one end, okay, we can see the ruffle border is there, okay, scalloped border is there, and that is the border, okay, that is the ruffle border that is usually facing towards the side of the bone, that is going to be resolved, okay. So you should take this concept, and this is very important. Also, the another important thing of this osteoclast is that we can see the multinucleation, okay. So here we can see different kind of lot of nucleus is present in the cell, okay. So it resembles with the giant cell, but the enzyme, but the chemical acid phosphatase, okay, it just distinguishes it from the giant cell. In another point, okay, so the factor that is responsible for the regulation of this osteoclast, okay, so we have one positive factor, another negative factor. Positive factor means it increases the osteoclastic activity, negative means it decreases the osteoclastic activity. So there are different kinds of chemical, okay. So I have taken this table from the Orbans, okay. So we can also prefer to the organs if Orbans, okay, if you want to learn more, but this much will be appropriate, okay. So this NK, K beta, okay, so this is also responsible for the positive action of this osteoclast. After that, vitamin D3, parathyroid hormone, PGE2, okay, prostaglandin E2, glucocorticoid, interleukin 1, interleukin 6, interleukin 8, interleukin 11, okay. So they are the positive factor. And the negative factor, we have osteoprotein, okay, OPG means osteoprotein, TGF beta, IGF1, IGF2, glucocorticoid, calcitonin, estrogen, interleukin 4, interleukin 10, interleukin 12, okay. So those are the chemicals, those are the hormones that is decreasing the activity of the osteoclast, okay. So we have completed with the all the topics of today's video, okay. So I have completed about the bone histology, which I think you have discussed, you have studied in your general histology or general anatomy, okay. But also, as we are discussing with the alveolar bone, it is important to discuss the bone histology here, okay. So I have discussed about the bone histology there, and after that we have completed different kinds of the bone cells, okay. Also in the bone cell, osteoblast, osteocyte, and osteoclast, okay. So we have discussed all those cells in detail, okay. So I have taken all those notes, okay. I have taken all those notes from the Orbans, okay. So we'll meet in the next video. Till then, stay happy, stay healthy, and tata, bye bye, thank you.